Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe how antibiotics get resistance. Antibiotic resistance is one of the biggest threats to global health, food security and development today. Antibiotic resistance can affect anyone of any age in any country. Antibiotic resistance occurs naturally, but misuse of antibiotics in humans and animals is accelerating the process. A growing number of infections such as pneumonia, tuberculosis, gonorrhea, and salmonellosis are become harder to treat as the antibiotic used to treat them become less effective. Antibiotic resistance lead to longer hospital stay, higher medical costs, and increased mortality. Scope of problems: antibiotic resistance is rising to dangerously high level in all parts of the world. New resistance mechanisms are emerging and spreading globally, threatening our ability to treat common infections disease. A growing list of infections such as pneumonia, tuberculosis, blood poisoning, gonorrhea, and foodborne diseases are becoming harder and sometimes impossible to treat as antibiotics become less effective. Where antibiotics can be bought for human or animal use without a prescription, the emergency and spread of resistance is made worse. Similarly, in countries without standard treatment guidelines, antibiotics are often overprescribed by health workers and veterinarians and overused by public. Without urgent action, we are heading for a post-antibiotics era in which common infections and minor injuries can once again kill. Prevention and control: antibiotic resistance is accelerated by the misuse and overuse of antibiotics, as well as poor infection prevention and control. Steps can be taken at all levels of society to reduce the impact and limit the spread of resistance. Individuals: to prevent and control the spread of antibiotic resistance, individuals can only use antibiotics when prescribed by a certified health professional. Never demand antibiotics if your health workers says you don't need them. Always follow your health workers' advice when using antibiotics. Never share or use leftover antibiotics. Prevent infections by regular washing hands, preparing food hygienically, avoid close contact with sick people, and keeping vaccination up to date. Health professionals: to prevent and control spread of antibiotic resistance, health professional can prevent infection by ensuring your hands, instruments, and environment are clean. Only prescribe and dispense antibiotics when they are needed according to current guidelines. Report antibiotic resistance infections to surveillance team. Talk to your patient about how to take antibiotics correctly, antibiotic resistance, and the dangers of misuse. Talk to your patient about preventing infections, for example, vaccination, hand washing, and covering nose and mouth when sneezing. What causes antibiotic resistance? These factors often contribute to antibiotic resistance. Overuse of antibiotics. Taking antibiotics when they are not needed are helpful contribute to antibiotic resistance. For instance, most cases of pharyngitis, sore throats are viral. Antibiotics would not help. Even bacterial ear infection often improve without antibiotics. Misuse of antibiotics. Bacteria can take advantages of any opportunity to multiply. If you forget to take medicine for a day or several days, stop treatment too soon, or use incorrect antibiotics such as taking someone else's medicine, bacteria start reproducing. As they multiply, they can change, mutate, bacteria become increasingly more resistant to medicine. Spontaneous resistance. Sometimes the genetic makeup DNA of bacterium change or mutate on its own. The antibiotic does not recognize this newly changed bacterium and cannot target it the way it should. Or the change helps the bacteria fight off the medicine's effects. What are superbugs? Some of years, various strains of bacteria have adapted to the medicine that typically kill them. They can fight back against the drugs called superbugs. These bacteria contribute multiplying and causing infections despite treatment with several different antibiotics. There's a chance that no antibiotics will work. Some bacterial infections with superbugs status include Clostridium difficile, gonorrhea, Staphylococcus strepto infections such as methicillin-resistant Staphylococcus aureus, MRSA, and tuberculosis. What are complications of antibiotic resistance? Healthcare providers have limited treatment options when bacterial infection become drug resistance. The problem can lead to increased risk of severe extended illness and death, severe medication side effects, longer hospitalized stays, more medical appointments, increased medical cost. Can you prevent antibiotic resistance? Yes. These steps may lower your risk of developing antibiotic resistance. Only take medicine prescribed for you. Don't take someone else's medicine. Follow your healthcare provider's advice to treat your symptoms without antibiotics. Don't pressure your providers for any unnecessary prescriptions. Set a reminder on your phone so you don't miss a dose. If you do forget to take your medicine, ask your providers what to do. Take all of the medicine as prescribed, even if you feel better. If you stop an antibiotics too soon, bacteria can start to grow again, and they may develop resistance. Wash your hands regularly. Good hygiene lowers your risk of getting a bacterial infection. Thank you for watching Daily Drug Info.